Perfect. Okay, so most of you already know this of that, Alberta has a mix of childcare arrangements, everything from nonprofit, for-profit, day homes, live-in nannies, babysitters, family arrangements, everything. I think some of what gets missed in our conversations, though, about trying to create a system of care for all the children in Alberta, is that as of 2021, Alberta only had enough licensed spaces for approximately 15% of children under the age of 10. And so what we're really talking about is a very small segment of the population where most people, if they are using care, are likely not actually in licensed care. And I think it's important to keep that in mind. We also have like a patchwork of funding of various streams. Often when I do this presentation, I'm also talking to folks that don't necessarily know that ECEs are the main workers in this field in the childcare sector. But one of the things that looking back 4 years ago is childcare was not actually a central campaign for some of the political parties that ran. And specifically, it wasn't actually a central campaign platform for the UCP. Next slide, please, Amy. Okay. So when we look at their 2019 platform, they don't actually mention childcare or plans or changes for it. I just need you to click once for me for that one. Perfect. And then again, what they did offer was a critique of the NDP plan, which was known as the $25 a day, which I'm sure you may or may not be familiar with. And what they had said is that it excluded rural families, shift workers, parents who work from home, as well as those who prefer less formal kinds of childcare. And I think it's really ringing from we only have 15% in licensed care. And then the NDP plan, when it had rolled out as a pilot, was only applicable to certain centers. And so it was even a smaller sliver of the sliver that actually have licensed care. Can you click again for me? When we look at the UCP, though, we can say they have like a couple general approaches that they bring to governance and how they are as a political party. And the first is they tend to limit government intervention. And this was no different for childcare. They didn't really want to have a major role in promoting childcare or creating a system of it. It was really, they wanted to depend on the free market in order to do that. The other thing that they had stated was a priority for them was parental choice. So they wanted to make sure that parents had the ability to choose which daycare and childcare arrangements that they wanted. And the last thing that they often talked about is they wanted to focus government funding on lower income families, so low to modest income families. So when we go through at the end of the 4 years, this is how I will kind of be evaluating them, is by their own criteria of what their goals were actually. You guys to the next slide. So the first thing I'm going to talk about is funding. Although the childcare wasn't part of their platform, it didn't actually stop them from coming in and making a lot of changes very quickly to the funding. And so some of you might say, oh my gosh, I completely forgot that this happened because it feels like forever ago. The first one was the Kin childcare subsidy, the Kin childcare subsidy. So this was a non-parent family member would care for a child, and the government would give the family money to give to their non-parent family member in order to do that. So when that was cut, it didn't just impact the families that relied on this, it also impacted the family member who was being brought in to help care for the child as well, because that may have been one of their only sources of income. So this was removed without consultation. It was also removed along with the stay-at-home parent subsidy. And this one was for parents who attended school or work part-time. Often it was used for preschools. And so when that was removed, it was a big problem for a lot of the preschools in trying to deal with clientele that no longer had access to a subsidy. Next one. We also saw changes in our parent link centers. And so these were kind of community centers where parents could go for support about parenting and caregiving help and whatnot. And so these were changed to what is referred to as a hub and spoke model. And their funding was cut overall and their clientele was expanded. So they used to be able to focus just on preschool kids, for example, but now they have to service up to teens in some cases with less funding. And also the parent link centers had to bid in order to get government funding again. So these organizations had to apply in order to get this new funding to stay afloat, and then also had to expand their clientele with less money. So we did see a cut there as well. Next one. The staff attraction incentive. So this was, designed to retain and attract ECEs by giving them a bonus for coming on and then also staying on for at least a year. We saw that cut and removed very quickly. And the other one that was really important, especially for northern communities, was the next one, is the Northern Living Allowance. So this one was really to support families in the north, where it was really hard to get ECEs to move to because it was so expensive to live there, and the wages just were not keeping up. So we also saw that cut, and that was in some cases about 1/3 of an ECE's wage was cut. The benefit contribution grant. So for those of you not familiar with that, this is to cover the top up of employer contributions based on the wage top up that government gives. And so we also saw this one cut. I know that it was brought back recently, but we're not entirely clear on how long it's going to stay. What prompted the bringing it back when it had been gone for a few years. It's obviously a really positive move that was brought back, but my understanding is it also was not brought back in its entirety. So it's not actually covering the entire expense that the government passes on to employers through the wage top up. And this is something that the employers, like providers, have no control over either. They can't opt out of this or change this expense in any way. It's just passed on to them to pay for it. And the last thing that I want to cover around funding was program unit funding. So this was funding for early education support for children who require or have additional needs. And we also saw this cut, which did have an impact on what some providers were able to do and what some ECEs were able to do with children who have additional needs. So that's just kind of a really, really quick summary of all of the various funding cuts we saw, basically in the first year to year and a half of the UCP government coming into power. So we go to the next slide. The next thing, that wasn't supposed to show up like that. Can you just click through and get some other things popping up? Maybe. Okay, well, we could talk about it anyways. The next thing that we saw was some policy and legislation change. So the first thing that isn't popping up on here is actually accreditation. So for those of you that don't know, this was an optional program that was supposed to promote a higher quality standard for childcare providers in Alberta. So it is above the minimum regulations that were in place at the time. There's definitely a critique of this program that for some centers and providers, it had really turned into a paperwork exercise. And so there was definitely room for improvement. But in March 2020, the UCP eliminated it. And this really happened with almost zero consultation. So programs were finding out that this program was gone at the same time as, everybody else. As a parent, it was disappointing to see this go away because this was one of the only external checks and balances that could actually look at a program and say, this is what we would consider high quality, and here's the metrics that we're using to assess the quality of this. Then we had the legislation reviewed. And so there was a promise that most of what was in accreditation was going to be rolled into the legislation and that it would then apply to everybody. So essentially the very small minority of licensed centers who had opted out of accreditation, because accreditation also used to come with the wage top up. So there was a large incentive to do this. And when we saw the licensing and regulations, they didn't actually come in until February 2021. So that was almost a full year after accreditation had been cut. And so it was really hard to see how they were rolling accreditation in when they had essentially a gap of a year where nothing was happening around improving quality in centers. But what we saw was their guiding priorities were reducing red tape, improving quality and safety, and enhancing parental control. And so I'm just going to talk about how some of those came out in the legislative changes that we actually saw. So for reducing red tape, we basically saw a shift to what is known as risk-based licensing. And this is essentially if a childcare center has not had prior issues, they're less likely to see a licensing officer come and do inspections, while centers who have had reported issues are more likely to have a heavy hand and see a licensing officer come to them more often. This comes with some obvious risks. So a facility is changing over time and standards are falling. That's not likely to be caught until there's a more serious infraction that gets reported. And they also moved And so there's obvious issues with that you'd like to not see happen. Also, the risk-based licensing tends to be really reactive and not proactive. So they're not responding until something has happened, and then they might see you more to be a little bit more proactive, but the proactive only comes after an incident has actually happened. So that's a risk. One of the other things that they did is they also changed the appeals process for infractions and disciplinary action under the legislation to make it confidential and privileged alternative dispute resolution instead of being a standard appeal that was actually more transparent for parents, for instance. They granted more powers to government to renew and grant childcare licenses to people or corporations who had previously been refused. And also they made it easier for corporations to transfer licenses to other corporations, where you really just need to submit to the ministry who's on the board of a corporation in order to transfer over a license. And it comes with a few extras, but they made those things easier, and those were all included under red tape reduction. When it came to quality, their promises around the accreditation being rolled into legislation, it didn't actually come to fruition. So what we saw was a preamble added. We saw a lot of language around quality, but very little in terms of things that can be enforced. In the chapter, I talk about it, that really what we have is a quality measure that's only going to catch the most egregious violations of childcare quality, and very unlikely to catch anything more than that. They could have done some other things. For instance, they could have mandated a curriculum. We've seen this in Ontario. We've seen this in Nova Scotia, some other provinces. That didn't happen. They could have enhanced qualifications for ECEs. That's often a really big measure of quality. We didn't see that. And then we also saw some of the ratios for caregivers to children actually lowered. So that happened when we added in mixed ages. You can lower the ratio for some children. And then also the exclusion of day home providers' own children, which does level the playing field for unlicensed. But instead of lifting everybody up, it was let's pull everyone down. So probably not the best when it comes to quality programming. And then parental control. So the new regulations did allow for 24-hour licensed care. However, the rollout of overnight care without any other corresponding labor policies that you might want to see, it has not been overly successful. As of March of last year, there were 97 spaces in all of Alberta for 24-hour overnight care licensed. And so those are some of the things that we saw. Can you go to the next slide? Oh, there's the accreditation one. There we go. So this is the kind of the path that the UCP were taking until some of the federal deals came up. So the first one I'm going to talk about is the multilateral, and this had been used by the previous government to fund their 25-day pilot program. So the UCP came in and they actually did the first parental subsidy increase that we had seen since 2008. So first, they increased the cap that families can make as an income to $75,000 a year. And then they later increased it to $90,000. And they did expand the subsidy amount that families were getting as well. And one of the important things for preschools was they also expanded preschool eligibility. So this helped made up for the stay-at-home parental subsidy cut that had previously happened at the beginning of their term. So they were able to use some of that. There are some clear flaws with the subsidy program, though, as it was set up. So families, like when it was capped at 75, if a family made 76,000 one year, they immediately lost out on just over $9,000 in subsidy. So it had a huge drop off, which obviously would, you know, if you're a family and you need that subsidy, you might be passing up work hours or raises just so you can keep your childcare subsidy, which isn't something that you want to incentivize. And more generally, the parental subsidy continued kind of this historic inequity where lower income families still end up paying a larger percentage of their take-home pay to childcare, which is really how you would want to make a parental subsidy based on how the percentage of a family budget that goes to childcare. That's how you'd want to do it to ensure that it's equal across families and that lower income families can still access care. So we didn't see that with the multilateral funding. The government also really wanted to talk about workforce. So they expanded wage top-ups to ECEs who are in preschools, which was also a really positive move. And one of the things that we noticed when we were looking at their announcements is they constantly be talking about workforce strategy funding is coming, it's coming every single time, but it's very light on the details of what the workforce strategy is, and we still do not actually have a concrete workforce strategy even years later after some of these agreements were signed. Accessibility, this is something they really highlighted also with this announcement. It was focused really around space creation. And they really highlighted again that this would help with overnight care. And as I said in the last slide, we've only, out of the 1,500 spaces that were kind of advertised that would be created for overnight care, we only had about 97 of them when the last annual report came out for this ministry. So we haven't actually seen these spaces come about. And then quality. This was really focused on educators and their certifications, but there was no clear plan. So we haven't actually seen how quality is being improved necessarily with some of the funding that's been rolling out from the federal government. So that's kind of just a highlight of the multilateral agreement. So Amy, can you take us to the next slide? Perfect. And then came what most people know as the $10 a day agreement. So this one had a completely different set of goals than the multilateral. So an average of $10 a day by 2026. So we're getting closer to that year. And they wanted to see growth in nonprofit and public care options and more supports for ECEs. There's a few other goals as well. These are just the ones that I wanted to highlight here. So I'll start with the operating grants. So this is how the government is funding operators directly, as I'm sure many of you know. It's not truly, though, an operating grant, but rather it's a form of parental fee subsidy, as the grants are designed to lower parental fees and not necessarily to support or enable the provision of quality childcare. So the operating grant is not a reflection of the actual cost of giving quality care to children. It's a reflection of the cost that parents were being charged, and the savings are supposed to be passed directly along to parents. Still, the grant flowing directly to the provider does give the government a lot of strings where they can tie specific things to the grant in order to incentivize certain behavior from a provider, or perhaps quality improvements and whatnot. That's not necessarily what's been happening, but it is one of the ways that the government can influence childcare in the community. Some other researchers, they looked at the operating grants though, and they basically came to the realization that providers in Calgary and Edmonton are unlikely to ever actually achieve $10 a day average because of how the operating grant was made up. So it was just a average across the province of all the fees that parents were paying, and then how much the government was going to put in. So in some cases where perhaps the fees were already lower, the grant that's applied to them really drops the parental fee, where in places where the fees are quite high, the grant does not drop it enough. And so you're unlikely to actually achieve the $10 a day for places where childcare is just more expensive because of how the grant is made up. Then parental subsidies. So this is how the UCP wanted to use a lot of the money. They increased it from $90,000 up to it was basically $180,000 for family income. And then again, this only applies for children up to kindergarten age. So we're missing an entire section of children that need care as well. And they really they really like this because they say that it gives parents more choice. But the reality is the parental subsidies, they give parents more choice in the sense that the parent is a consumer and they are operating in what is known as a fair and free market. But that's just never actually been practiced. There's just not enough childcare availability for parents to essentially shop around to find quality care. And so they don't become a better or more savvy consumer when they're given parental subsidies. It doesn't actually work that way. And so we have a long history of doing this in Canada, of trying to give money directly to families, and it's never made care more affordable or available throughout the country. But we did this. The design was better though than the last one. It didn't drop off immediately if a family got a small wage increase. So that was a much better design and just a lot better for families. Okay, one of the things that we did recommend that they could have done instead though was implement a fee cap and then do a parental subsidy that's scaled down so that people on the very low modest income families would essentially have free childcare, where families that are making $180,000 wouldn't necessarily have very high fees, but they might be paying a higher amount, but it would be capped for all families. That would have been a better way of going about it. And then lastly, ECEs. So in late 2022, we saw wage increases on the top up. It was really positive. It had been, the wage top up had not been increased for many years. When we did calculations, we saw that the wage increase in 2022 basically kept the top up to the rate of inflation. So the top up accounts for about 25% of these workers' income. And so 25% of their income kept up with inflation since 2008 approximately, which means their wages have not kept up with inflation because only a small part of it has actually been increased at the rate of inflation that we've had. And then one of the other things that we saw was level 1 training opening up. So that's positive to get some more workers in the field. It's not great to have a lot of level 1s entering though without a plan to move them up to level 2 or level 3. And it puts a lot of pressure on operators to bring these workers up to speed, especially for the workers that were just taking the about 50-hour online course and didn't actually interact with children during their training. So there's still a lot of training that falls on operators. And one of the things that we've asked the government to do, though, is also track who's taking the online level 1 course and if they actually end up working as an ECE, because it's not a requirement that, they can just take the course, and we actually like to see them track it through. And we've been told that they are not tracking this. So that's kind of an overview of the $10 a day and how it's been used so far. So the last agreement that we're just going to go over is the most recent one. Amy, can you just switch us over to the next slide? Perfect. And this is the cost control framework. So I know that they're in the middle of kind of doing consultation on the implementation of this. So this critique is just really about what is actually in the agreement that the province signed with the federal government. And it really does seem to undermine this idea of getting to $10 a day, even on average, promise that was made by the previous agreement. It changes the program after providers have already signed on, which is extremely problematic for providers that, are hoping to offer $10 a day. The government is telling them there's some different terms and conditions that you're going to have to adhere to after you've already signed on to this. That makes it really difficult to operate as a provider, and also makes it difficult to try to explain what's going on to parents. And one of the other issues around, this whole idea about core childcare and how reasonable profit that are included in this agreement is that it conflates profit and surplus, which are two distinct things in accounting, and they're not equivalent, but it kind of puts them side by side as equivalent. We've also had this idea that there will be enhancements, so kind of this menu that parents can pick from, where they can pay additional fees and have enhancements off of a core or base childcare, if you will. So parents will be forced to take on more costs or likely see the quality of their programming for their children downgraded, which I don't think any provider necessarily signed up for. I don't think any family wanted to necessarily sign up for this either when we were hearing about $10 a day. And providers will be forced to eventually divide out their program. Depending on how core is actually defined, they'll be forced to divide out core and enhancement because an enhancement must be optional. So if you are providing an enhancement and you're paying for it with the fees that are being given by the operating grant or parental subsidies, or just the direct parental fees that are paid to your program, a parent could technically come in and say that they want to opt out of an enhancement and then see a decrease in their parental fees. So this is really administratively a nightmare, to put it mildly, and I don't think it's what a lot of providers had initially signed up for either. Okay, and one of the other things that has caused a lot of confusion is reasonable profit. So it's not clearly defined in the agreement, and in some of the consultation that has happened, some providers have essentially been told, The reasonable profit is as anything that, so we're going to give you, $100. If you can provide care for $80, then $20 is your reasonable profit. And so this incentivizes providers to try to provide care as cheaply as possible in order to be able to make a profit. And it's just not great to incentivize anybody to do that. And it really is opposing other cost control frameworks that some of the other provinces have. So PEI has a cost control framework, and their reasonable profit is based off of a percentage of how much a provider invests in their program in improving it in quality. So that type of cost control framework incentivizes people to invest in their program, where the one we have incentivizes people to not actually invest money, at least, into their program. And then the last point is that there was very little consultation on actually signing the cost control framework. And that really seems reflected in what the cost control framework deal actually lays out. It really seems like it's almost a lack of understanding of how the childcare system works and how we can incentivize improvements within it, especially compared to some of the cost control frameworks that are coming out across the country. Okay, so if we just go to the next slide, and we're going to just wrap these up with an evaluation based off of the UCP's own metrics of what they said was important to them. So when it comes to government intervention, the intervention of the provincial government really changed with the federal deals. So the federal government coming in with a lot of the money they came in with forced the UCP kind of to become more engaged in the childcare sector and to actually do more than perhaps they were willing to or wanting to do before. Though we did see less government interaction through inspections for some providers achieved in the legislative changes. When it comes to parental choice, the funding cuts that were made very early in the UCP's term actually limited parental choice when it came to childcare availability and options in Alberta. So the stay-at-home subsidy and the kin care subsidy, those ones actually limited a lot of parental choice and options that families wanting less formal care perhaps would have actually used. And the lower cost without a plan for increasing supply as well as increasing the ECE workforce has also limited choice. So a lot of parents they even have less choice than they had before perhaps, because we aren't caught up with the system that we are trying to achieve yet. And we don't actually have a very clear path on how to get there. When it came to free market, free market was mostly maintained. So that's something that when they said that this was important to them, they were able to keep that with most of their policies and how they implemented a lot of the federal program. And then lastly, the other thing that they had repeatedly said was that they wanted to make sure that government money was going towards lower income families. What we're finding though is that the government funds are not targeted at low income families. So the expansion of the parental subsidy to $180,000 doesn't necessarily achieve that, when more money could have been concentrated for lower income families than perhaps higher ones, while still maintaining a cap. That could have been a way of achieving it. But what we find when they're actually spending money is they don't tend to target low or modest income families as much as just enhancing parental subsidies for the majority of families in Alberta. Okay. And so I just want to take us to the next slide. So what we in Childcare Now Alberta are doing about this is we do have a campaign going on right now on our website. There's a letter writing tool in regards to the cost control framework that kind of lays out some of the issues with it, and that we'd really like to see the province and the federal government take another direction. That the cost control framework we have right now is really a step in the wrong direction. We don't want a program of two-tiered childcare in the same center. We don't want to have ECEs explaining to children that they can't access specific food or activities or events because their parents have chosen not to pay for it. That's not going to improve quality in Alberta. And it's really not something that many in the sector would support or stand behind. And so we have a campaign going on right now where you can use our letter writing tool to contact federal and provincial representatives to let them know that we'd really like to see this addressed and let's not move forward with something that's so flawed to begin with. And one of the other things that we're working on, since we are in an election period, is a political platform comparison. So we're just waiting to hear back from some of the political parties to make sure that we're giving a good comparison of all the options available. And we'll also be amplifying the work that's being done by other organizations who are also comparing some of the childcare focused policies that the provincial parties are looking at or promoting. So that's the end of the presentation. We can do, if anybody has any questions or anything, I'd be happy to take them now.
Susan, we have a question in the chat bar. Someone asked, can you please send out the link to this recording so we can, right?
Yes, absolutely. So we'll send that out to folks that weren't able to make the lunchtime meetings, and also for you folks so you can refer back to it if you like to or anything like that.
I just wanted to actually say thank you for summing this up so well and for giving us the tools that we need to be able to advocate for the field. So much appreciation. And I was the one who actually asked if we could share this recording because I'd really actually like to be able to publicize it a little bit more too and see if I can do some, getting the community to better understand how we got to where we're at now and what are some of the plans that we need to move forward. So a big thank you to you and a big thank you to Childcare Now for actually sponsoring this. This has been fantastic. Much appreciation.
Absolutely. Really happy that it can be useful because I think some of us, with COVID, it kind of warped our sense of time and we forget everything that's happened and that it's only been 4 years. Okay, so I see Carolyn's question also in the chat of the textbook. So it is called Anger and Angst. I actually have a copy of it here. Jason Kenney's Legacy and Alberta's Right. So it is put on by the Parkland Institute, which is out of the University of Alberta. And they have chapters that cover all sorts of things and just policy changes, things that have happened over the past 4 years. So I know they have a section on labor. They have the section I wrote on childcare, as well as energy policy, education policy, some of the other social stuff around homelessness, approaches to municipalities. So it's quite hefty, but it's a really good read for everything that's happened in the past 4 years provincially. Perfect. So if anyone has any other questions, you can always feel free to email us. If you're not able to put in your question right now in the Zoom chat, that's absolutely fine. And then we'll send this out, and we'll also be sending out any other information that we have about some of the political party promises, so that you can look at that and you can do what you like with that. We're not endorsing anybody. We just want to make sure that we have a good idea of track record and the visions for going forward and being able to evaluate that. Okay. So with that, Amy, I guess I'll hand it off to you.
Okay. Thank you, everyone, for joining today's meeting. We are very happy to have you. And if you have any questions, like Susan said, feel free to contact us. We will send out the meeting record file shortly. And okay, that's the end of the meeting. Thank you. Have a nice day. Bye-bye.